Dr Richard Bircher and I work as a GP. We've made this short video to explain to you how you can test for your own oxygen levels at home safely if you are unwell with coronavirus. Now thankfully most people who catch coronavirus do not become seriously unwell, but some do and need hospital care. Falling or low oxygen levels are a sign that you could be becoming unwell. Other signs are having a fast heart rate, becoming more short of breath, or feeling very fatigued. Now, some people are more at risk of becoming unwell than others. For example, people aged over 65, people with long-term conditions such as diabetes, heart disease, or chest conditions, or people on medication that suppress their immunity, for example, chemotherapy. An oxygen level of 94% or below could mean that you are becoming unwell. And if you get a reading of 94% or below, it is worth reporting this to your practice, or if your practice is closed, to 111. Some people may run a low oxygen level because they have a chest condition, and the 94% cutoff doesn't apply to them. But your doctor, who knows you best, should give you an idea of what your reading should be when you need to worry. Now, a pulse oximeter is the device that we're going to tell you about. Here is a pulse oximeter. You test it by doing this. Sometimes these machines have switches on and off, sometimes they just start when you open them up. To begin with, switch the machine on, making sure your hand is clean. Place one finger into the device so that the light inside is either on top or below your finger. And then wait. It's important to wait for at least a minute for the device to stabilise. And then you should end up with two readings. In my case, my oxygen levels are 98% and my heart rate is 74. Please make a note of all the readings you take, and take the readings 3 times a day, in the morning, towards the middle of the day, and in the evening. You can take readings more frequently if you're concerned. Now, if you get a reading of 94% or below and you feel entirely well, the most likely reason for this is that the machine is not registering things correctly. They can be temperamental. It's worth taking your finger out, switching the machine off, back on again, making sure you insert your finger correctly into the machine and start the readings all over again. Now, your practice may collect data and your readings in different ways. Some practices may ask you to phone them every day. Some practices may set up a text system so you can just text your results through. And some practices may ask you just to contact them should your readings hit 94% or below. Now, we hope that by monitoring your oxygen levels, we can spot who may be becoming unwell and do something about it before you become seriously unwell. We're trying to keep you safe. Thank you for listening.